We'll get started in a few moments when everybody has had a chance to. Welcome to those coming in. Great to have you with us. Welcome to everybody coming in. It's great to have you with us. We'll be starting in a moment. If you'd like to introduce yourself in the chat, that would be lovely. Welcome to all joining us as you're coming in. Please feel free to introduce yourself in the chat and we will get started very soon. Looking forward to discussing climate change, human health and philanthropy. We'll just give another second more as the numbers are just creeping up. Right, we'll begin. Welcome everybody to our session on climate change, human health and philanthropy, where we're going to be discussing the intersection of human health and environmental issues and how funders can support both. We are, of course, on social media, so do join the discussion using the hashtag NPC Ignites. We'll be taking points of clarification after each of our panels share a few thoughts, so please let us know in the Q&A or the chat. And after the panel have spoken, we'll open up for wider questions and conversation. Please remember that the session's being recorded and journalists may be present. So it's my great pleasure to introduce you to our panel today. We have with us Justin Johnson from CIFF, Florence Miller from the Environmental Funders Network, and Peninah Murage from the Centre for Planetary Health. We're going to be kicking off today hearing from Justin, who's Director for Climate at the Children's Investment Fund, CIFF. Justin leads the climate team's work on cities, industry, air quality, and in Europe. He joined CIFF from Centrica, a UK-based energy company, where he held various senior roles. And prior to that, Justin was a specialist advisor to the UK Secretary of State for Environment, Food and Rural Affairs, the Right Honourable Hilary Benn. And there he covered a range of issues, including climate change, energy efficiency, water and air quality. Thank you for joining us, Justin.
Thanks, Liz. Great to be here. You can hear me okay? Great. Well, look, thanks everyone for joining. I'm really looking forward to hearing from my fellow panelists and, of course, to kind of engaging in the discussion with you folks, because, of course, the only way we can do this is by just collaborating more and sharing expertise and knowledge. I'm just going to give a little bit about CIFF's journey and then deep dive a little bit on air quality and health and climate, which is where I've been doing a little bit of work. So CIFF was established in 2002, and it's focused on improving children's lives, and it has a kind of range of work from child health and development, adolescent sexual and reproductive health rights, equality for girls, child protection, and climate change. And we work in London, Nairobi, Addis Ababa, Delhi and Beijing, and have very deeply rooted local strategies. I think what's really interesting is in the early days when it was just set up, CIFF was really solely focused on child health and malnutrition in developing countries, particularly in sub-Saharan Africa. But it became ever apparent that increased crop yields and increased sort of work on food production were constantly being hit by recurring and significant droughts and crop failures. It was clear that unless we also tackled climate change, we'd be running to stay still. And as is kind of widely known now, climate change really affects food security, water scarcity, migration, spread of deadly diseases. You basically can't tackle these problems unless you're also tackling climate change. There was a very powerful report that came out from UNICEF recently, which highlighted this and sort of gave some real evidence and numbers to it, that approximately half the world's children live in extremely high-risk countries from climate risks. That 820 million people, that's children, that's over a third of children globally, are currently exposed to heat waves. And 600 million children, that's one in four globally, are currently highly exposed to vector-borne diseases such as malaria that are likely to worsen through climate change. So we all know this now, and the numbers just keep on coming out to us that climate change is impacting children's lives now, and will have a worse impact on them if we don't tackle this climate emergency urgently. So the team was formed about 10 years ago at CIFF. Started quite small, focused on the UK and coal, then moved to Europe, and then has grown sort of geographically. As I mentioned, we've got teams now in India and Africa and China, and we're working also in Southeast Asia. And we've also grown in scope too. We were focusing very much on coal, but now we're looking more broadly at the energy transition, and we're looking at transportation, and also looking at novel techniques like litigation and finance and other ways in which we can sort of shift the system on course to 1.5 degrees. Because as the IPCC report said, we are in code red and emissions are actually going up, and the case to act is absolutely clear. And yet, only 2% of global philanthropy is going to climate. 2% of global philanthropy is going to climate in the context of this emergency. So there's a kind of, thanks very much for sharing that, Jasmine, the really powerful UNICEF report. There's also a great Save the Children report as well, which I'll post later. So clearly there's a prevention of health impacts and risk. But the thing that strikes me as well is in tackling climate change, we can also tackle the health impacts that come from climate problems, the mitigation aspects. So this is particularly around air quality and clean air. So just to sort of pepper a few more stats in there, 2 billion children, 90% of children globally are breathing dirty air under WHO standards, and they've actually revised the guidelines down, as you probably know. So it's going to be an even more stark number than that. And air pollution, coming from often the burning of things and often the burning of fossil fuels, can affect our lungs, heart attacks, strokes, asthma, bronchitis, heart ailments, lung disease, cancer. High PM2.5 can impair, which is the small particulate of air pollution, can impair brain development. So this is a shocking health impact from clean air in itself that's leading to about 4.2 million premature deaths globally. And in the UK, 36,000 early deaths on average across the UK population. So by tackling clean air, we are going to save lives directly. And also, if we tackle it at the root cause way, we can also address the problems that are causing climate change. And proof that this can be done is something like London's low emission zone, which I'm sure you all know was introduced for the central London congestion charging zone. And it reduced toxic air pollution by a third by reducing the number of cars coming in by 13,500 every day. And as you probably know, in 2 weeks' time, the ultra low emission zone is going to be extended across all of the kind of north-south circular in London, covering that whole zone. So policies to get dirty vehicles off the road with incentives for walking, cycling, public transport and clean transportation can clean the air and cut emissions. And philanthropy can make this happen, because philanthropy co-funded the low-cost sensor network that was put in place to evidence these benefits. It's called Braid London. Philanthropy and civil society and academia collaborated to increase pressure on this issue, to make the economic case for this issue and to make the political and social case for this issue. And Client Earth, funded by philanthropy, provided the stick of litigation against national government to kind of force action on this issue. And then networks like UK 100, also funded by philanthropy, can then make sure these policies are replicated across cities in the UK. And global networks like C40 can also replicate them around the world. So I'm really convinced, and we've got good evidence to show that we can save lives and we can tackle emissions and get further co-benefits of better cities and greater well-being by finding these co-benefit opportunities of tackling air pollution as well as tackling the climate crisis. And there are other opportunities like domestic coal burning in Poland, shutting fossil fuel plants, electrifying the best bus fleets, and that's just on the clean air and climate nexus. And yet, I said 2% of philanthropic funding is going on climate. 0.1% of air quality, 0.1% of philanthropic funding is going on air quality, 0.1%. So I think the onus is on all of us to find the co-benefits in all aspects of tackling the climate emergency. So whether our focus, like CIFF, is on children, other focuses are on health. And I know I have a number of sort of partner funders working on something like the Clean Air Fund who can see that health benefit. Or whether you're working on nature or whether you're working on the arts, there's a way of finding ways in which tackling the climate emergency can also meet those objectives too. Because as I said at the beginning, is the IPCC, the kind of panel that looks at climate, the status of climate in the world, said we're in a code red situation. So I hope that was helpful, and I really look forward to having a discussion with you about what the solutions might be.
Thank you so much, Justin. I really love that focus as well on the opportunities and the co-benefits. Sometimes topics like climate change can seem quite overwhelming, but we all have agency to support and find those win-win situations. We don't have any points of clarification, so we will move on to hearing from Penny Murage. Until recently, Penny was the co-deputy director of the London School of Tropical Hygiene and Medicine's Centre on Climate Change and Planetary Health. And her research there examines the health effects of changes in the environment, such as climate change, and assesses the impact of interventions, solutions to provide rapid transition to a zero carbon future. She has extensive experience of working in public health policy and previously worked with both Public Health England and the Department of Health. Thank you so much, Penny.
Thank you for the introduction, Liz, and for your brilliant talk, Justin. I really enjoyed hearing that. I think you've captured the issue globally very well, and I liked also the focus on solution, which will be a central focus for my talk as well. So I'll make 3 brief points, and then I'll end with some statistics that I think are quite revealing, and I think they'll help steer the discussion a little bit. So I'll start off by making an argument why we need to go beyond climate change, and this is not to diminish climate change. It is still a huge issue, an important one. But this is to remind ourselves that beyond climate change, there are other significant environmental changes, and that their risks to human health are also significant, and some of them are unknown. So we've probably, some of us have probably not heard of the concept of planetary health. It is a newer concept, but really it promotes the understanding that human health and the health of our civilizations depends on healthy natural ecosystems and how we sustainably manage those ecosystems. And in the past, through exploiting those natural systems, we've become healthier and wealthier. So if you think of improvements in life expectancies globally, and also reductions in poverty, has come about because we've exploited those natural ecosystems. But this has resulted to a devastating loss of those ecosystems. And this concept is captured very well in a really good report that came out from the Lancet Commission on Planetary Health. So that report came out in 2015, and I encourage you to read it. It's called Safeguarding Human Health in the Anthropocene Epoch. So the planetary health framework really depicts 9 boundaries. Like I said, climate change is one of them. And the others are things like biological diversity, so biodiversity, probably familiar with that, ocean acidification, freshwater consumptions and global hydrological cycles, soil biogeochemical cycles, and many others. And the framework uses a traffic light color coding, yeah? So it gives us an idea of where we've gone beyond what they call the safe operating space. So green zones, we are below the boundary, we're doing very well. The yellow zones are areas of increasing risk, and this is where we are in terms of climate change. But then there's the red zones, yeah? And so this is where we've gone beyond that safe operating space. And that's where we are in terms of biodiversity because of the significant loss of genetic diversity across the world. And then there are other boundaries that we don't have any data, so we don't really know what the impact is in terms of human health. So I'll talk a little bit about my work. So I previously worked on climate change, trying to understand the issue, quantifying the problem, but I'm trying to steer away from that and looking more at solutions. So try to understand what works and where does that work, yeah? And you've probably heard of this concept of nature-based solution, which has grown in popularity for very good reasons. Because when we work with the natural environment, natural systems, when we enhance those systems, we can deliver multiple benefits. And these benefits are more or less where there are competing objectives. So there's always competing objectives or priorities in terms of, do we deliver health, or do we promote economic development, or do we safeguard the environment? But working with nature can be a win-win situations for all those priorities. So I'll give you a brief example of my current work in East Africa. But before I do that, I'll just want to say that there's a little bit of, I guess, a quiet storm that's happening across Africa, really, in terms of ecological restorations. So you may have heard, so for example, of the Great Green Wall, which is a cross-country collaborations where different countries have come together to try and build a green wall, starting from Senegal in West Africa and going all the way to Djibouti in East Africa, so it's north of Somali. And it's an 8,000 kilometer wall, 3 miles wide, of trees and vegetation. And the idea is, how do we stem the encroachment of the Sahara Desert? That's a really good example of a nature-based solutions. I'm not involved in that. I'm involved in a smaller project based in Tanzania, in the north, in Dodoma, where conservation groups are working with local farmers to restore and regenerate the degraded landscapes using a technique called farmer-managed natural regenerations. And what they tell me is that in the last few years, they've managed to restore or regenerate up to 6.3 million trees. Now, the health benefits of this work has not been captured, and that's where I come in. And if you can think of it, the health benefits and the societal benefits are numerous and enormous. And I really enjoyed hearing your talk, Justin, about childhood malnutrition, because I think these are some of the areas where we can have most benefits. So these techniques works where farmers integrate trees into their agricultural landscapes. So trees and crops and livestock all coexist together. And some of the benefits include things like nutritional security because of better crop production, mental health benefits, improved water catchment, less migration and less conflict, but also carbon mitigation benefits when carbon is sequestered from the atmosphere. Lots of other benefits in terms of economic and in livelihood improvements. And I think I'll close there, but in closing, and I know there's lots of philanthropists and funders in this room, I just want to leave you with 3 points that, when you're making those funding decisions, things that you can consider. And the first one is research that focuses on solutions. So what works, how it works, where does it work, so what's the context, and how can we scale it up to work better? And the second thing is funding interdisciplinary research. So there's very few funders who fund research that cross-cuts between health and the environment. And this hinders cross-disciplinary collaborations. So that's my plea to you. And the third one is research going beyond climate change. And I think I've talked about some of those issues, but there's one specific ecosystem that I think is poorly funded in terms from a health perspective, and that is soil. It's such a vital and fundamental ecosystem and really foundational to all the other ecosystems. So when you think of food production, you need fertile soils. And my last point really is about equity and justice in funding and how funding can really help address equity issues. And I'll give the example of Africa, but actually this applies to all developing countries across the world. So we all know that the poorest nations, particularly those in the global south, have contributed the least to climate and change and global greenhouse emissions. And I think there's some statistics that in African countries only contribute about 3% of the emissions. Yet they're warming faster than the global average, and they have populations who are highly vulnerable in comparison to the global average. But the problem is that global funding on environmental change and research does not match that scale and the severity of the issues. And so here are some statistics I found out this morning. So only 4% of global funding for climate change research is spent on African topics. And very little of this goes to African institutions. In fact, the vast amount, 80% of this funding goes to institutions based in Europe and North America. And just to drill down a little bit, using the example of the Green Climate Fund, so this is GCF, it was a huge funding program that was created to support efforts in developing countries to respond to climate change. And they came out with some statistics very recently showing that out of the 1.2 billion in funding to fund 15 climate projects, only 2% of that amount has gone to developing country institutions, so directly to institutions based in developing countries. And I'll stop there, just to emphasize that there are significant inequalities that need to be addressed in terms of who's contributed, where the vulnerability is, and where the funding is going. Thank you.
So interesting, Penny, thank you. And so many parallels between the international and the UK experiences, where in both cases we see inequality as a key theme, and those who are vulnerable for other reasons, perhaps existing health inequalities, perhaps they're living in the poorest areas with the lowest incomes, tend to be the people who will be hit the hardest. We're going to move on to Florence next. Florence Miller is the director of the Environmental Funders Network, which brings together trusts, foundations, high-level individual donors supporting environmental issues. And she's authored and co-authored various EFN research reports and publications that aim to support funders in making more informed and strategic decisions about their grant making. And before working at EFN, she ran a grant-making program herself focused on conservation that engaged new audiences in the US. Thank you, Florence.
Great, thanks so much for having me, Liz. It's a real pleasure to be here. Really wonderful to hear Justin and Penny's talks, and I hope what I say will complement what they told you as well. Talking about the ways in which environmental issues are mostly actually not environmental at all, but deeply human issues, you know, caused by humans, but also profoundly affecting humans, is quite close to my heart. I've always felt a bit hamstrung that the organization I run is called the Environmental Funders Network. It's really sort of the human and environmental funders network. So you've already heard Justin and Penny talk so eloquently about the connections between health and climate and other environmental issues. And I thought I would just elaborate a little further on some more of those connections and give you a sense of the kinds of fundable work that exist to address these issues at their intersection. So for the co-benefits that Justin was talking about. And once you start digging into those connections, you start to find that it's all tangled up in a sort of web of cause and effect that goes in multiple directions. I am really useless at PowerPoint, so I ended up drawing a picture just to get my thoughts in order for this session, and then I thought, well, I'll just share that picture. So excuse the fact that this is no artistic masterpiece, and it is also not comprehensive in any way. But can you see that all right, Liz?
Yes, we can. It's lovely.
But it starts to give you a sense of where, you know, health overlaps with climate change and other environmental issues. And I've sort of put in blue, in the pale blue, you can see the health impacts of different issues. And then in the green, you can see the sort of more environmental impacts, so effects on habitats, wildlife species, the climate, and so on. And then a theme that runs across all of them, which Penny was just alluding to, and Liz, which is in orange, is that of equity. So the really, really unequal distribution across different populations and then different socioeconomic groups within populations of various environmental impacts on health. But as I mentioned, this is a really complex web where cause and effect goes in multiple directions. So for example, climate change is having an impact on our ability to grow food globally, but our food and agriculture systems, meanwhile, are impacting on climate change. So of course, some estimates put meat and livestock as contributing anywhere from 15 to 50% of our global greenhouse gas emissions. And then of course, as you know, diet is a key contributor to health. And sometimes the things we need to do to improve our diets and therefore our health are the same things that we need to do to address climate change. So reducing our meat intake, for example. And then this web of cause and effect just keeps getting more and more complicated the more you look at it. I started sort of figuring out, you know, this leads to that and that leads to this. And you end up with this totally tangled web. And I think the main takeaway for me of this is that this is a profoundly important intersection for us to be focusing on, because it's going to pay off in terms of a host of different issues, no matter which one of these areas you end up looking at. And as Justin was alluding to, the problem to date has been that none of these issues has really received much philanthropic attention at all. So our research was showing that from UK-based trusts and foundations, the total amounts of money for years going to all environmental issues globally from UK foundations was around £105 million. And that at the time was 3% of UK overall philanthropy. So this tiny fraction and this tiny sort of absolute amount going towards the issues that essentially underpin not only our health and well-being, but our entire economy and, you know, our survival as a species. So there's this profound disconnect. Luckily, we're about to publish a new report that maps out grant making from UK foundations, and it shows a really significant rise in those giving levels. So it's now on the right trajectory, which is brilliant. And I think funders are really starting to recognise the necessity of funding into environmental issues for a host of reasons, and also the really valuable role that private philanthropy plays in driving the changes that we need. So on these kind of thinking about these sorts of different areas, these sorts of issues, what interventions might funders make with payoff on both health and environmental fronts? And I feel like you could slice and dice this in various ways, but the way that comes to me with this lens in mind is the same way that anyone who's focusing on health issues is probably thinking about things, which is in terms of prevention and cure. So if you start thinking about, okay, well, what's the preventative work we need to do? And then what's some of the curative work we do? How does all of that intersect with environmental issues? So preventative work is obviously about stopping bad things from happening, preventing people from getting diseases, preventing the environmental impact. So if I quickly choose this section on my diagram about zoonotic diseases, a key cause of the release of zoonotic diseases is the degradation of ecosystems, deforestation in particular, largely for agriculture, intensive livestock rearing, and trade in wildlife and wildlife markets. In fact, more than half of zoonotic diseases can be traced to agricultural drivers. So there's a really great deal of work that could be done preventing habitat loss, restoring ecosystems, preventing illegal wildlife trade, and then addressing this big issue of factory farming. And I think the latter should be of particular interest to anyone who cares about health because of the connections between factory farming and the rise of antibiotic resistance. So I'm showing here just a few of myriad organizations that do brilliant work on this front. You know, there's Fern, which is a European-based organization focused on campaigns to change policy in the EU in terms of the types of imports they have that affect forests. There's the Environmental Investigation Agency, which works on wildlife trade. There's Compassion in Wild Farming, that has brilliant campaigns on factory farming. There are, of course, brilliant organizations and initiatives doing work in all of these other sections, but for the sake of brevity, I'll just reference one more thing in terms of prevention. And I'm going to come back to air quality, even though Justin's already talked about it, because I think this is a sort of under-discussed part of the health impacts of air quality, and I think it's really fascinating. And that is that I mean, I know that you'll be aware that air quality affects lung disease, heart disease, tens of thousands or millions globally of premature deaths, but it also affects mental health. And there was research published just earlier this year that you might have seen reported in August from the Journal of Psychiatry that showed that a relatively small increase in nitrogen dioxide emissions, which principally come from vehicles, led to a 32% increase in the risk of needing community-based treatment, so people going to see their doctors for mental health issues, and an 18% increase in hospitalizations. So I think those are absolutely stunning, shocking figures. And the researchers pointed out that it's actually quite hard to treat mental health issues on a case-by-case basis, but you can go upstream and just prevent the air pollution happening in the first place. So that, you know, with ULEZ, the ultra low emissions zone in London, for example, that Justin just pointed out, it's very possible to affect changes that then benefit the population as a whole, which is much more effective than it would be treating things individual by individual. And I'm showing here just a few organisations here in the UK that work on air quality issues and do brilliant work. So Possible does some great work coming up with alternatives for getting around for transport. Choked Up does brilliant campaigning on air quality and the way it particularly affects young Black Londoners and people in other cities. Mums for Lungs likewise mobilises mothers to campaign on air quality. So that's a really quick look at preventative work, and we could go on for hours on that. On the curative side of things, I wanted to touch on this idea of prescribing. So many of you may be familiar with this concept of social prescribing, where you go to the doctor and you get a prescription not for an actual, medicine, not for a drug, but for something that helps you, that is more social. So our leaky homes in Britain, which is the worst country in Europe for energy efficiency, are a major problem, both in terms of meeting our climate goals. It's one of the biggest issues we need to address to reach our next climate budget in the UK, but also in terms of the problems associated with people living in cold and damp conditions. And with skyrocketing energy bills this winter, that is only going to increase, with millions of people struggling to pay their energy bills. And I actually heard a doctor speak at a conference a few years ago on social prescribing, who was talking about how he had been literally prescribing boiler services for his patients, for elderly patients who are at risk of pneumonia. He was writing a prescription for them to get their boiler fixed. But we also badly need to insulate all our homes in Britain and our buildings to meet our climate targets. And we need to get off boilers and get onto heat pumps and other alternatives. So here are a few organisations that I think do fantastic work on this front, including E3G, which has been at the forefront of policy development and coalition building around energy efficiency, National Energy Action, which specialises in addressing fuel poverty, and then NEF, the New Economics Foundation, actually has a relatively newly launched campaign on insulating our buildings in Britain. And then the final thing I'm going to mention on the sort of curing side of things is nature prescribing, which in Britain has been pioneered by people like Dr. William Bird, who's really fascinating to hear talk about this. And it aims to address the health problems resulting from our disconnection to nature. And Dr. Bird argues that this disconnection is associated both with chronic stress and with low physical activity. And when you combine that with poor diet, it leads to chronic inflammation, which, as he puts it, is the base cause for all long-term conditions, for so many of our chronic illnesses and deathly illnesses that people suffer from. So nature prescribing aims to get people out and about into nature, doing something meaningful, whether that be mindfulness practice or a conservation volunteering project, in a group. So it's sort of tackling three things that we evolved with. So being outside all the time, over evolution, we've spent most of our lives outside doing something meaningful, i.e. searching for food and shelter, and in a group, in a social group. And he feels we've sort of lost a lot of those things. It's really badly impacting on our mental health. And that in turn leads to other illnesses. And it seems to work. So for example, participants in the Wildlife Trust's volunteering programs report that their mental well-being increases by a significant amount during the course of their participation. So I guess I'll wrap it up there, but I think this sort of thing, this kind of work, getting people outside, especially if they're doing conservation projects, is essentially prevention and cure. And it's a sort of testament to the power of nature, which we rely on in pretty much every way. Thanks, Liz.
Thank you so much, Florence. That was absolutely fabulous. And as you say, the interconnections are extensive and complex, and we have but scratched the surface this morning. But I think that gave us a really fantastic indication of that area that we're thinking about. So to kick us off, I have our first question from the floor, which is, I'm going to start with directing this to Justin, but the others will want to chip in, I'm sure. So Justin, when you were speaking, you mentioned that only 2% of philanthropy goes on climate. And we could and should increase funding for environmental charities. But do you think we need to get to a stage where funders are supporting charities in all sectors to help different social groups be part of the climate transition? Be that, for example, health, young people, poverty reduction. What's your thoughts on that?
Well, I've got a short answer, which is yes, and a long answer, I guess, which is why, but I'll pass to my other colleagues. So, I mean, as Florence's really elegant, actually, artwork showed, the interconnections are massive, and because you could do another sort of one all the way around, I think, that is all of the types of organizations that intersect with that, because there will be community groups in many of those. There will be so many different parts of civil society and academia and others that will have this other layer of web over that, that will be coming from very different places, but actually kind of come and have intervention points. So absolutely, I think so completely. Yes, I'll pass on to others.
Penny, you were also mentioning the intersectionality issues when you were speaking. To what extent is our funding too siloed between health funding and environmental funding, and how could funders support more multidisciplinary work?
Yeah, I mean, I equally liked Florence's talk, and just showing that complexity. You know, it's something that we grapple with a lot. So for instance, I'll give you an example. We're just in the middle of writing a grant application. And what I'm increasingly told is that funders will only want to fund one outcome and not another. But I think we need to go beyond that silo thinking of just one outcome. So for example, one health outcome could be mental health. But all these things are very interrelated, right? So it's not just mental health. So people experiencing mental health challenges will also be experiencing air quality challenges and all the other wider determinants of public health. So I think it's also a question maybe posed to funders, is it true that you only focused on what, I mean, from what I'm getting from this is that it's not true, that you are interested in the whole interlinkage thing. And I think it's an important one, because I don't think the real life experience is not experienced in silo. You know, it's all these influences hitting humans at the same time. So I think, yes, the answer is yes, we should be funding environmental project linked to health, but also linked to the wider determinant of health. So things like livelihood and poverty, for instance. Education is another big one that no one has talked about.
Florence, would you like to add anything?
I think I'd just add that when we fund in a very siloed way, there are trade-offs. You know, you can be very effective focusing on one thing, but almost inevitably you end up having blind spots and unintended consequences as a result. And so the question to me always ought to be who benefits and why. There should, you know, any kind of environmental funding needs to have a human lens to it. And when it hasn't had that lens, you know, the environment sector has done some things that it should not have done, globally speaking, in terms of conservation. And it's sort of facing a reckoning at the moment because of that. And that funders are responsible as much as the NGOs themselves. I mean, I guess I'm referencing work that has actively harmed Indigenous communities, for example, in terms of on-the-ground conservation. So I think it behooves us to have a lens that is multiple.
Can I just come in on that a little bit more? I think 2 points. I think firstly, Penny's point about local institution capacity building is key. I think the more solutions start at a very local level and go up, the more likely they are to be interconnected, because that's where people will be looking at them from. They will be able to see all the different elements and piece them together in a far better way than people who are more distanced from them. So I think that's a core component. I think the other thing, to your point about trade-offs, because Florence, when I saw your chart, it was a beautiful explanation about how actually, if you, as you say, if you have your eyes open, you can go in at any point and not just focus on that, but help shift the entire sort of system. So I thought that was a really exciting and engaging way of getting in. I think there's also the counter to that, which is that there may be some trade-offs. So on the air pollution side, things that we've come across is actually to try and stop burning domestic coal. The sort of cheapest and most cost-effective way is to stick in a gas network. Or electric vehicles are actually got a lot of tire and brake wear, which leads to particulate pollution. So they might be the best sort of They might be the most attractive climate solution because there's a lot of EV momentum, but they're not necessarily helping air quality. So I think, you know, not only can we help enhance the whole system by having that wide lens, but we can also navigate through these inevitable trade-offs and complications which we will come across because of the complexity of the system.
Thank you. So forgive me for missing the last seconds of that, my internet connection not being very kind. I'm going to pull a couple of questions from the Q&A that relate to this kind of space of the intersectionality. We're being asked whether enough has been done to inspire about the potential of the world on the other side, and if we focus more on the excitement of a better world rather than the horror that we face, if that will open some of the discussion further, wider, deeper.
I can come in on that. I mean, I really strongly believe that. I don't think we've done a good job of putting forward a vision of what the future could look like. And I think that's hard work and we need to do it quickly. And I think people are naturally drawn to the positive. I mean, even just hearing Penny, you talking about the green, what was it called again? The Great Green Wall.
Green Wall, yeah.
Yeah, it's really inspiring. It's it's visionary. And those sorts of things attract people to them. And we're, I mean, I know this has been said before, so apologize for the cliche, but we are very good at saying I have a nightmare and not I have a dream in the environment sector.
I agree with that. Oh, sorry, Penny, you go. Let's see you off me, please.
Oh, go on, Justin. I was just going to agree with Florence really, and just say it has been an intentional move of mine, career-wise, to go beyond the problem and to start focusing on the solution, and not just focusing on the solution, but trying to showcase those really good examples, because there's so much happening. We don't always know what's happening, but there's so much happening. A lot of it hasn't been evaluated to know the impact of those solutions, but also the trade-offs. So I think we need to get to that state. Thank you.
I agree. And there was a question about speakers as well, I think. And there's actually a TED organized countdown going on in Edinburgh at the moment, where there's just this whole conveyor belt of inspiring speakers. So I think we should check them out and see if there's anyone there. We're definitely better at saying it's a climate emergency than we are saying it's a climate opportunity. So I completely agree. I think the other thing we need to be mindful of is what will actually resonate with people, because what we probably want to avoid is like coming up with our own personal visions about what this great future might look like. But actually, it's not the future people want. Different people might want very different things, and that may still be possible too. So I think actually the citizens' assembly model was a really compelling, it was quite policy wonky, but it was a really compelling way of just understanding what kind of society do you want to create, and therefore what changes need to be made to be brought about that. I think more of that kind of piece is actually really needed as well.
In our plenary session on the environmental crisis on Tuesday, Polly Billington of UK 100 urged funders to fund more advocacy work and less on things like schools education packs. And she felt it's the political will and the shifting public funding that's needed if we're to address the scale of the climate and move to that ideal world that we want to see out of the other side. To what extent do you agree with that? You'd like to take that first, Justin?
Well, I thought you were motioning the hand to the mute button, Florence, but I think it's key ultimately. I think I do think that the rules of the game need to change, and policy and regulation and funding are the kind of core components of that. But back to my citizens' assembly point, I think it's got to be done in a way that is enduring, and therefore we as a public kind of buy into it, and therefore we'll be supporting it regardless of who's in power. So that's the only caveat I'd say to that.
I mean, I totally agree. I don't have anything wildly interesting to add to that. I really agree with it. I think environmental education has played a really important role in raising awareness and consciousness over the decades. And we also need to do the really hard-hitting work that will actually, as Justin says, change the rules of the game. But I think that the environmental education that has happened to date has helped create a public, there's been polling even just this week on what people want to see happen. And it's sort of got people educated to a degree where they know that we need to make changes now. And now we need to translate that into pressure on decision makers.
Yeah, and just extending that, there's been quite a lot of controversy in the environmental movement around the UK government's sort of proposal to every step counts and trying to encourage very small individual actions, which will collectively make a difference, but are fundamentally insufficient and put the responsibility on the individual, whereas actually they're fighting against a system which is carbon intensive and harmful and for the environment and health as well. And so I think that's the tension to bear in mind too. Education, but education to create the pull for the conditions and the regulation.
I just wanted to quickly come in and on the advocacy part and say it's really encouraging, particularly to see what young people are doing and how they're pushing their agenda forward. It's really encourages and it kind of promises a better future. But then alongside that, it's this something that's been discussed a lot is what do we value, right? So, and the whole idea of using GDP, for instance, as a measure of wealth, perhaps should change to something more along the lines of something, using well-being and human welfare as a measure of health. But I don't know. I don't know how to get there. I think some countries like Bhutan, they have a happiness index instead of GDP, and they are clearly very happy.
So we have both funders and charities in the room today, and in order to get action at the pace and the speed that we need, funders and charities are going to be needing to discuss what is needed on both sides, what the funders' hopes are in being able to support charities and what charities might need from their funders. What advice would you give to each side of the table? If it's charity listening, thinking, we'd like to take action, but we don't have the resources, how do I raise this with my existing funders or others? And vice versa, if it's a funder who's not been involved in funding at the intersection of health and the environment, what would be your advice to them on where to start and where to go for information?
I can have a stab at taking that first. I mean, I think one of my answers is the same for both of them, which is everything needs to be done right now. It all needs to be done. And whatever issue you are focused on, it will intersect with environmental issues and climate change. There's absolutely no way it doesn't. So then the question becomes, all right, what is your particular niche? And you can be thinking about that in terms of the sort of the range of environmental issues out there, whether you can affect energy use or, I don't know what it may be, toxic chemicals or something to do with building the sustainability of communities. Then there's all the approaches that need to be used. So we've talked about advocacy, policy work, there's litigation, et cetera, environmental education being one of them, activism. And then there's the geography, like where are you working? So once you've sort of thought through each of those, where do you fit in terms of each of those? What are your strengths? What can you bring to the table? It helps narrow it down into something that's a bit more digestible and feels a bit more aligned with exactly what it is that you can contribute.
It's a great answer.
And what about for charities sitting there thinking, what next for us? What would you recommend to them in terms of how and when to engage in conversation with their existing funders?
So I mean, everyone, I think to this point about urgency, we all have a responsibility to talk, I think, to everyone about, what are we doing and what could we be doing differently and better? I think, the thing Greta said about, obviously awful and horrific impacts of COVID, they did show us how we can respond to an emergency, how we can do things fundamentally differently and have different types of conversations. So for funders who are focused on climate already, that's the conversation they want to have. I think that those that aren't, and I think, and that's the climate silo. But as Florence has said, actually, the intersection now is so strong, and ecosystem restoration that Penny mentioned, and nature, the nature nexus and the health nexus, is really moving at great momentum. People are seeing the kind of the synapses are all happening and sparking off. So start those, and then start with each other. I think start engaging and exploring. It's like Florence's web. I think that just get in there and start like feeling out where is the role that you and your colleagues and have in that, and how can you just sort of strengthen the bits. I'm going to remember your web for the rest of the day, Florence.
That's brilliant. I mean, I would just add to that.
I like a little bust picture of it, by the way. That was one of my favorites.
Oh, that was the most fun to draw. The thing I would add to that is Catherine Hayhoe, who's a climate scientist in Texas and talks a lot about how you talk about climate change. She's from a sort of very conservative Christian background, and so she specializes in talking with fellow conservative Christians in the States, which have typically aligned with a sort of climate denial in the past in the States. Not that happens really in the UK along any religious lines. But her main point is talking about climate change is the most impactful thing any individual can do. And I think that probably applies at the charity level too. If you're talking about it with your donors, that is a really valuable starting point, just getting the conversation out there and inviting people's expertise and ideas.
We've been asked another question in terms of how do we approach measuring impact? How do we know that what we're doing is effective? Penny, perhaps that's one you'd like to take.
Yeah, this is something that we've been grappling with quite a lot. I think understanding impact or evaluating impact, it's so vital and yet poorly researched. So I'm working with a project. It's called the Lancet Commission on the Pathfinder Initiative, and we're trying to map the pathways between health and carbon mitigation by reviewing all the literature that's out there, including doing a systematic analysis. But what we're finding is researchers typically report one or the other, so they probably report the environmental benefits, but not the health core benefits. And so it's an area that really, we're trying to promote and saying to people that when you take a piece of work, or when you fund a project, for instance, or when you evaluate that project, try and understand not just the environmental measures or estimates, but also the health and the core benefits, or in terms of health, but also in terms of livelihood. But the question is, how do you actually measure impact? As researchers, it's really difficult because we don't implement anything. So you'd have to work with the implementers. And this is what I was trying to do with my work in Tanzania. I'm not going to go out there and restore and regenerate trees. I'd love to, but I can go there and build on the existing work and try to estimate and measure what they're doing. For nature-based solutions, there's another added layer of difficulties because of the delayed impact. So when you restore a landscape today, it probably take 5 to 10 years to see any benefits. And so some of those projects will need to have long-term funding. So it's not just 1 or 2 years, we're probably talking about 5 to 10 years. And the other thing is that we need to work across disciplines, right? So I have a public health background. I understand health very well. I don't understand ecology very well, and they tend to use different languages. There's lots of jargon, but it's trying to understand how we can get to a place where we're speaking, we're using the same language. And the other thing that I'm finding that I'm having to learn is the idea of using new methods that I haven't used before. I mean, there's lots of brilliant statistical approaches to understanding the problem using many techniques, but I think we need to get out of our comfort zone and learn how to understand the problem and the solutions in a better way. I'll stop there. I'm sure someone else has something else to add.
Yeah, just to build on that. So I think tracking the drier indicators is now quite well established. coal pipeline or renewable electricity or electric vehicles on the street and all of that kind of stuff. So that, like, are the fundamentals of the economy shifting in the right direction at the pace needed is going okay, and things like the Committee on Climate Change are excellent at producing that kind of analysis and sort of holding the government to account. But to this point around intersection, and this point particularly around equity and justice, which is fundamental, because if climate policies are not fair, they will fail, and they are taking us in the wrong direction. How we measure impact in that regard, what's a useful sort of indicator for that, I think is uncharted territory. And I think, speaking from a climate environmental perspective, we need to do much more kind of listening and understanding with other social sciences to work out sort of how we can be useful there.
Thank you, guys.
It's just to add it. I mean, it obviously depends on what issue you're focused on. So if you're focusing on air pollution, well, it's pretty straightforward. If air pollution, you can measure very quickly if air pollution falls, and then you can start to see, has that had any impact on hospitalizations, etc. So some things are much more straightforward, but of course, while you're working towards the policy change, how do you know if you're making progress? And so that's when you need to start looking for sort of proxy indicators that there's public support for this, and more MPs voted for it this time than they did last time. That sort of thing is just a bit trickier, but possible. And then there's also the counterfactual. That's the other thing which I think plagues measuring impact across environmental issues, because things could have been a lot worse if we hadn't been doing this work. I mean, all our indicators are pretty dire, but they could have been much, much worse had we not been doing the myriad campaigns, etc., that are in play. That's very hard to measure.
I have a question for you, Florence and Justin. Do you think funders have a role in ensuring that the funding that they're providing, that impact is demonstrated? Is that something that you normally ask for?
I think CIFF might be. At CIFF, it definitely is. But we collaborate very closely with our partners to develop a meaningful framework for what tracks progress. So, something like air pollution, if we think that can actually, there's a link between the activities that are happening and that, then that's useful. But otherwise, exactly as Florence says, like what's the useful intermediate outcome indicators that we can look at to say, here are the 3 or 5 things that we're really focused on, which takes quite a long time to develop them together. But once they're in place, it's a more straightforward process because you can just rely on them and look back to them. It's certainly something we try and support development of.
It really varies by funder, because there are some funders who are philosophically opposed to that, an approach that is fixated on indicators. Like I can think of a board member of EFN who ran a foundation for a long time and felt that some of the work that they had accomplished, they would have given up on long before if they'd been needing to see any kind of proxy indicators. So they funded, there was some, I can't actually remember what policy it is, so sorry, but they were funding policy work that took 20 years to see any progress on. And then one day the opportunity arose and everyone was ready for it and it was seized. So, he feels quite strongly it can put, if you're focused on impact, it can put you off. Of course, we need impact. That is the whole point of doing this work. So quite a lot of money can be wasted if you're not paying attention to it.
Yeah, I think particularly when it comes to understanding how we're mitigating carbon, I think that's where the gaps in the evidence are, and that's probably where we need to demonstrate impact.
Thank you so much. Sadly, we are quickly running out of time. I would love to ask each of you to give your top takeaway or two for the audience from this session before we close. Justin, Penny, then Florence, please.
Great, thank you. Well, I mean, it's been a really rich conversation, so thank you everyone for the questions and the discussion. I think what I got from Florence's chart is this affects all of us in different ways, but the flip side to that is all of us can have a role in different ways. So we need to all step up further and more to play in that. I think secondly, from all the conversations we've heard, it's clear that the solutions are there. The solutions are there, and actually the best solutions are probably ones that are more local, but feeding up. I really take it by Penny's point. And thirdly, I'd say seize the co-benefits. We had it from Penny's chart, and we had it on nature restoration and ecosystems restoration, from Penny's chart and Florence's chart. Florence's chart, Penny's ecosystems restoration. Anyway, we got all of that. We seize the co-benefits, but I guess don't get stuck in a quagmire of them either.
Mine is really brief, and I keep coming back to this idea of how do we develop that unifying approach? So how do we bring in people from an environmental background, health background, and economic backgrounds to work together to some sense of unity? And I think COVID sort of took us there. So it kind of unified the environmental aspects and economic aspects, but we need to do more. And I guess maybe to urge people as they're thinking about environmental outcomes to try and think alongside those, what are the health core benefits and what are the economic core benefits? And I think, it can be a single health outcome or a single environmental outcome with multiple core benefits, but to try and bring it together, so not in silo, but together. So yeah, unifying approach is my summary.
Yes, I would really agree with all of those. And in terms of this unified approach and a sort of interdisciplinary multiple lens approach, I think talk to as many people as you possibly can who come from very different angles. Someone asked about COP26 in the chat box, and honestly, personally, what I'm most looking forward to getting out of COP26 is people are coming from all over the world, making a huge effort to get here from places that are really badly affected by climate change. And I'm looking forward to talking to them and hearing their stories and hearing what they think needs to be done, because presumably they are the most affected, have the most valuable ideas. So that to me feels like a really important piece, is bringing in perspectives from a range of different people.
Thank you so much to the panel and to the questions from the audience. EFN and NPC are publishing a briefing for funders on the intersection of health and the environment, funded by CIFF, which will be published in the coming weeks. So to make sure that you hear when it's published, please sign up to NPC's newsletter. And this is only the beginning of the journey, and NPC and EFN and others have much planned with partners to raise awareness at the intersection of social and environmental issues. You can see a little bit more on our website. Please do get in touch. I hope you enjoy the rest of Ignites. The plenary sessions start again at 1:45 with a keynote presentation from Sunil Shah, the CEO of the Asian American Foundation. And please come and join me and others in the networking area beforehand. Thank you so much. Have a good day.